हाँ जी।
हेलो।
हेलो, अस्सलाम वालेकुम। आवाज आ रही है आमना?
जी वालेकुम अस्सलाम, बिल्कुल आ रही है जी आवाज़।
और जनाब, कितने बजे शुरू करना है? बस शुरू करने लगे?
जी ये ज्वाइन कर रही हैं, साइमा गुलजार ज्वाइन कर रही हैं, और आई थिंक अभी 1-2 मिनट में और लोग ज्वाइन कर लेंगे तो हम स्टार्ट कर लेते हैं, जैसे एक्सटर्नल्स भी ज्वाइन कर लेते हैं,
ठीक है।
क्योंकि एग्जाम ब्रांच की तरफ से तो डॉक्टर ताहिरा
less than 18 years and to the adults more than 60 years. 4-point Likert rating scale items were designed in a 4-point Likert rating scale presented to the participants, and all 40 items were retained, no items was excluded. Then factor analysis, exploratory factor analysis was run to establish its factor. And for this purpose, 250 participants, which were HCV positive patients taking treatment of um, in conventional interferon, pegylated interferons, and oral antivirals and mixed treatment were taken. 40-item list was presented to them, and data collected and analyzed on HPSL and resulted in three-factor solution. All factors had good internal consistency, and eigenvalues of all three factors were as follows. Factor 1 had 17.2 eigenvalue, factor 2 had 8.4, factor 3 had 3.7. These factors were named as first factor was physical factors with 19 items in it. It had reliability of 0.98. Second factor was psychological factor. It had 12 items with 0.95 reliability. Third factor was neurological factors with 5 items in it, and it had good reliability with 0.92. In the second study or second stage of this research work, psychometric properties of this scale was established. For this purpose, EFA resulted in a three-factor solution. We can confirm this three-factor solution through CFA, and all the models resulted in a good fit. CFI with 0.92, TLI with 0.91, GFI with 0.93, and root mean square error of approximation with 0.05. Internal consistency of the scale was 0.97. If discriminant validity for this scale was also established using WHO quality of life breath scale, and it resulted in a good significant negative correlation with -0.72. Convergent validity of the scale was also established using neuropsychiatric inventory questionnaire NPIQ on 50 participants, and it resulted in a significant positive correlation with 0.76. In third study, predictive and mediating role of health-related quality of life, coping strategies, and the side effects of HCV treatment was identified. For this purpose, a purposive sampling technique was used to select the participant. 100 participants for this study was selected, which were HCV positive. Age range of the participant was 18 to 60 years. Patients who came to receive final dose of treatment were selected for the assessment. Patients were divided into 4 treatment groups, with each group having 25 participants based on the type of treatment they were receiving. Group 1 was receiving conventional interferon treatment. Group 2 was receiving pegylated interferon treatment. Group 3 was receiving pegylated plus oral antiviral treatment. And group 4 was taking oral antiviral treatment alone. These three variables and measures were used in this study. Side effects of HCV treatment are divided into three types of side effects, which were physical, psychological, and neurological side effects. And these side effects were measured through indigenously developed scale and an NPPSIS. Health-related quality of life is operationally defined as a person's perception of their situation in life within the perspective of the ethnicity and value system in which they survive, and in relation to their ambitions, expectations, and standards. Health related quality of life was assessed by using WHO Quality of Life BREF scale. Coping strategies were defined as an attempt, either behavioral or psychological, that people use to conquer, bear, decrease, or reduce stressful life events. Coping strategies were defined operationally by an individual score on coping strategies questionnaire. All three measures had sub-factors. NPPSI had three factors with good reliability scores. WHO Quality of Life BREF scale had four domains: physical quality of life, psychological health-related quality of life, and social relationships and environmental factors. All four domains had good reliability scores. Uh, Coping strategies questionnaire also had four sub-factors, which were active practical coping factor, avoidance focused coping factor, active avoidance focused coping strategies, and religious focused coping strategies. All four sub-factors had good reliability scores. In this study, it was assessed that physical and neurological side effects were more prevalent in females, and psychological side effects were slightly more prevalent in males. Findings also showed that physical side effects were more experienced by the patients who went through conventional interferon treatment. Neurological symptoms were more significant in pegylated treatment group of patients. Psychological side effects were significantly experienced by the patients of pegylated interferon and oral antiviral treatment group. All three side effects were significant in these group of treatment. Predictive role of side effects for health related quality of life and coping strategies. Physical side effects were proven to be negative predictor in patients who were negative. Physical side effects was the significant negative predictor for religious focus coping, psychological quality of life, social relationships affecting health related quality of life, and environmental factors affecting patients' quality of life. Whereas physical side effects also proven to be positive, significant positive predictor for active distractive coping. Neurological side effects was a significant negative predictor for religious focused coping and psychological health related quality of life. Psychological side effects were identified as significant negative predictor for avoidance focused coping, religious focused coping, psychological health related quality of life, and social relationships affecting health related quality of life. All three side effects, physical side effects, neurological side effects, and psychological side effects, were positive predictor, significant positive predictor for active distractive coping. Now we will see the predictive role of coping strategies for health related quality of life. First, active practical coping was a significant positive predictor for two domains of health related quality of life, which were social relationships and environmental factors. Active distractive coping was a significant negative predictor for fourth domain of quality of life, which was environmental factor. Avoidance focused coping was a positive predictor for second domain of health related quality of life, which was psychological health, and negative predictor for social relationships. Religious focused coping was a significant positive predictor for physical health related quality of life. Mediating role of coping strategies with side effects and health related quality of life was also assessed. Avoidance focused coping was found to be a significant negative mediator between psychological side effects and psychological health related quality of life and social relationship. Active distractive coping was found to be a significant negative mediator between neurological side effects and environmental factors affecting health related quality of life of these patients. This is a chart for mediating role of health related quality of life, coping strategies, and side effects. To conclude this study, I would say there is a famous saying in medicine and psychiatry: one size doesn't fit all. It means a treatment regime which might be beneficial for one person might not be tolerable for another person. This study concludes that different treatment regimes have different types of side effects, and these treatment regimes affect the quality of life in different patients with HCV in different ways. Moreover, the result of this study further elaborates the psychological impact of treatment and coping strategies used in patients while facing the side effects of different treatment regimes. Study further concludes the impact of different practical adaptive and maladaptive coping strategies. Practical adaptive coping strategies I would say, were as active practical coping, religious focused coping, and maladaptive coping strategies were active distractive coping and avoidance focused coping. These both type of coping strategies affect the quality of life patients who were undergoing treatment for HCV. This study provided us with potential a lot of implications for the benefit of society. Um, First of all, we will talk about the significance or implication of this study on further specific patients in treatment regimes. The result of this study can be used for designing better and more personalized treatment regimes for patients with different psychological and biological and social status. Analysis of health related quality of life in the study can be used as a guidepost for policymakers to design better healthcare facilities for better well being of patients. This study can help psychologists in the treating team to better psychoeducate and prepare patients for treatment related side effects so that better and proactive adaptive coping strategies can be used to overcome the stress related to the side effects. This study also provide a base for further research in this area regarding well-being of patients and better coping of treatment-related side effects. Interferons are also the drug of choice for the treatment of for different other diseases such as cancer and autoimmune diseases. The findings of this study and an NPPSI scale can be used to further build on the research in these fields as well. Recent studies suggest that there is a group of patients that have resistance to oral antiviral drugs for HCV, and these patients need addition of interferon therapy in their treatment regime. NPPSIS will be an important tool for these patients to manage the treatment related side effects. This study had certain limitations and suggestions as well. First one was the current study is conducted on a small sample of patients being treated in two centers where patients from a specific socioeconomic background are treated. It is needed to further conduct this study with pre-treatment psychological assessment to see the impact of side effects on lives of patients with different psychological status. It is suggestive to include pre-treatment psychotherapy for patients to improve their quality of life by using more effective coping strategies when faced by side effects of treatment. Psychologists should be an integral part of treating team in the clinics and centers designed for cure of hepatitis C so that patients can be provided with counseling to combat debilitating effects of treatments of side effects. Thank you so much.
जी, thank you Naima for your presentation. नाउ आई हैव अ सजेशन, अवैस साहब भी कंफर्म करेंगे, हमारे पास 8 रिमेनिंग मिनट्स हैं, तो 8 मिनट में अब वाइवा तो नहीं हो सकता, तो या तो हम इसी सेशन को दोबारा ज्वाइन करके स्टार्ट करें वाइवा, ताकि आपके पास हाफ एन आवर हो और आप आराम से क्वेश्चंस कर सकें।
जी अभी 8
मेरे
मिनट रहते हैं, तो इसको यहाँ क्लोज कर देते हैं, फिर दोबारा से स्टार्ट कर देते हैं।
जी
हाँ
मेरा
जी,
ख्याल है कि फिर बीच में डिस्टर्ब होंगे, इसलिए पहले ही हम इस लिंक को ड्रॉप करते हैं और इसमें फिर हम जो कंसर्न लोग हैं ये दोबारा से ज्वाइन कर लेते हैं और
ठीक
हम
है,
वाइवा स्टार्ट कर लेते हैं।
चले मैं बंद
अच्छा।
कर
और इस तरह करेंगे अवैस साहब
जी
वाइवा के, इसमें जो मेंबर्स होंगे ना वो दोनों एक्सटर्नल एग्जामिनर्स डॉक्टर आमना और मैं होंगी,
ठीक है।
और
ठीक है, और
मिस
आप
साइमा
और
गुलजार भी
साइमा
होंगी।
गुलजार हैं।
बाकी लोग ज्वाइन ना करें, अगर फिर कोई करें या मैं फिर एक्सेप्ट ना करूं, ऐसे कर लें।
हाँ
हाँ
जी
जी, साइमा गुलजार, आप, डॉक्टर आमना, दोनों एग्जामिनर्स, और मैं होनी चाहिए अगले वाले वाइवा के सेशन में।
नेक्स्ट वाइवा में
नहीं नहीं, अभी
ये
जो
तो
हम दोबारा ज्वाइन
अभी
करें।
तो आप
तो मैडम वो जो एक्सटर्नल है उनके नाम क्या क्या है?
डॉक्टर राफिया रफीक और डॉक्टर शाहिदा बतूल।
ठीक है, ठीक हो
ठीक
गया,
है, और स्टूडेंट जो है वो नाइमा हसन है।
ठीक हो गया।
ठीक।
ठीक है
ओके
ना?
जी, ओके जी, मैं तो बंद कर
थैंक यू
थैंक यू।
अवैस,
ओके।
थैंक यू
डॉक्टर
डॉक्टर
आमना,
आमना।
अस्सलाम
जी
वालेकुम।
वेलकम।
हाँ जी डॉक्टर आमना,